right, it's 7 p.m. Eastern time, so I'll go ahead and start. Thank you everybody for attending this virtual town hall of the Anchor study. We're very happy to have you here. I just wanted to mention, when you logged on to the meeting, you saw a box that showed an audience poll. It's just to help us understand who's attending the meeting so that we are able to, we're able to know with whom we're speaking. All of your answers are kept anonymous. And there is an interpretation service available for this talk today. And so if you'd like to have interpretation in Spanish, please click on the interpretation box as you see here along the bar. So use el botón de interpretación para escuchar en español. Okay, hopefully everybody who wants to be connected is connected to interpretation. This event is being recorded. It can be shared on the study website, so you'll be able to access it there, share the link with others if others are interested in hearing about what we speak about today. So tonight we're here to talk about, I'm trying to change the slides. There we go. Tonight we're here to talk about our Anchor study results, talk about next steps for the study, and to hear your questions and hopefully provide some answers. I want to give a special welcome to everyone who's joining from a viewing party, especially in DC. Shout out to DC. And thank you all for joining. So as you see, we're going to talk for about 25 minutes. We'll go through some introductions, talk about the background, the results, and the next steps. We're going to wrap up about 5 minutes before the hour so that we can finish up all the questions and answers and make sure we conclude on time and have a chance to thank everyone. If we don't get to all the questions, please feel free to reach out to your sites, and we're happy to answer those questions individually. And you can also use the study website as a way to reach us for a response. So I'm Hillary Dunleavy. I'm the protocol co-chair, and I'm the site PI at the University of Colorado. As you know, our study protocol chair is Joel Pilevsky, and he's at UCSF. Also doing some of these town halls is Isabella Rosa Cunha, and she'll be joining at some point tonight. She's at the University of Miami. We have 3 CAB members who may be joining us tonight. John McFeely is at Miami, and he is the CAB chair. Derek Mapp is the AMC community liaison, and he's at UCSF. And then Bill Freshwater, I know he's on for sure, and he's a CAB member in DC. So if you would like to ask questions during this town hall, please use the Q&A function as seen in this image here. Type your question in. You're able to click if you would like to ask a question anonymously. We'll ensure your privacy if you'd like to ask a question anonymously, we won't reveal your name. If you don't send it in anonymously, we may answer a question to your name. You can also use our Q&A for technical support. And then if you're Spanish speaking and you want to type a question in the Spanish question and answer, it'll be interpreted for both languages. Okay. So if you want to talk to anyone one-on-one, contact your local study team, and I'll show you a map of that coming up. And if you want to watch a live stream or recording, that'll be on our website, www.anchorstudy.org. So now for a little bit of background information. So this may seem like a silly question, what is the anus and what is anal cancer? You know, many people come to us after they've had a colonoscopy and they'll say, do I really need to have an anoscopy as well? Well, an anoscopy is just looking at the last couple inches of the anal canal. And so we see a little bit of the rectum, which you can see in the picture here. And then we see the anal skin as well. So we insert a clear plastic scope into the anus past the external sphincter muscle, that muscle that we relax if we need to have a bowel movement. And we look on the inside at the last couple inches there. So what is human papillomavirus? So we know that what we're here to talk about is HSIL. And HSIL is high-grade squamous interepithelial lesion, and this is caused by the virus HPV. So this virus can cause skin warts. There are 150 types of this virus overall. Only some types of this virus cause anal and genital warts. And then some types of the virus, those types that are called high risk, can cause precancer. So precancer can go on to develop cancer. And I'll show you a little bit about the changes in the cells and how that can happen, how that can go on to develop cancer. HPV is super common. It is often sexually transmitted, and it is about 80% of adults or more have HPV sometime over the lifetime. So I already mentioned HSIL. What is anal HSIL? Well, it's high-grade squamous interepithelial lesions. It is not cancer, but it's considered a precancer. It can worsen over time and become cancer, but it can also go away on its own and then come back on its own. The virus, the HPV, is what causes the changes to the cells, and the cells themselves become abnormal after the infection with HPV, and they can get worse, but they can also get better. So we can do minor treatments, including infrared coagulation and electrodesiccation or hypercation. Mainly those three things just mean burning off the abnormal area. So burning off the areas of HSIL. Most people recover from the treatments we use pretty quickly and without too much trouble. And this type of treatment is not dangerous, but also the HSIL itself, I already said it's not cancer, so it's not dangerous as long as it doesn't get worse. So a lot of people are concerned when they get this result of HSIL, but again, it's not cancer. So cancer is when it starts to invade into the tissue below the skin layers. And so it can spread to other body parts once it invades into the tissue. That's something called metastases or spread of cancer. It doesn't go away on its own once it becomes cancer. Often we treat it with chemotherapy and radiation, and if it becomes advanced, it can be fatal. So anal cancer rates are high in people living with HIV. We estimate that if an HSIL or a precancer is untreated, up to 10% of individuals who are men who have sex with men living with HIV who have precancer can go on to develop cancer. So in the general population, though, the most number of people with anal cancer are women. So how does that work? So people living with HIV who are men who have sex with men have high rates, meaning your risk as an individual is high for cancer. But in the general population, there are very many women, and even though the risk is lower, it will affect more women. So why do we care about preventing anal cancer? Like, can't we just treat it and be done with it? Why do we have to go through this screening? Well, even if we detect it early, before it spreads, it can cause lots of side effects, including sexual side effects, bowel movement side effects, and other things that affect the quality of life. So the chemo and radiation can have effects that last. The survival is good if we catch it early, though, which is great news, but there's still many side effects. So if we can catch it before it gets to cancer, even early cancer, we can make a big impact on people's lives and prevent them from having these side effects. Unfortunately, metastatic anal cancer has poor survival. If it's already spread, you can still treat with chemo and radiation, but the chances of dying from it are high. To check for anal cancer and for HSIL, we recommend a digital anal rectal exam. So that's when the provider inserts their finger and feels around for any lumps or bumps or abnormalities. We can also find other things that could be causing issues as well, such as warts and fissures or tears in the skin. And then the other thing we can do is an anal swab, which some of you who, if you're a participant, you've probably already experienced, which is just inserting a swab a couple inches into the anal canal and collecting a few cells by rubbing it against the skin tissue for about 15 to 30 seconds. So then anoscopy, or high resolution anoscopy, is when we take that clear plastic scope and we insert it into the anal canal. We use vinegar and iodine and something like a microscope called a colposcope to magnify and look at the tissue to identify areas of abnormality. When we find these areas of abnormality, we can take a biopsy or a very small piece of the tissue and send it to the lab to diagnose and determine if we have an abnormality such as HSIL or anal cancer. So then how do we treat it if we find it? We use devices that focus heat or electricity to destroy just that surface layer of skin. The other option is to use a topical cream to help shrink or remove the area of HSIL. Most of the time, this is tolerated fairly well, with a little bit more pain and some bleeding the first couple of days, but most people tolerate that and improve after a few days to a week. So let's talk about the anchor study. So cervical cancer and anal cancer are pretty similar. It's the same types of cells that can develop from HSIL. So it's something called a squamous cell that can have abnormalities develop and turn into cancer over time. We know that treating cervical HSIL can help prevent cervical cancer. So if we know that, why do we need to do the anchor study to demonstrate the same thing with the anus? So the anus is different. The anus has a different surface area. It takes a different technique to be able to evaluate it. And we had no proof until the anchor study was done that treating HSIL helps to prevent anal cancer. So now we did the anchor study. And we compared anal HSIL treatment with monitoring. So monitoring was, we didn't let people go very long. We checked them every 6 months or more often to try to monitor over time. And then in the treatment arm, anybody that had H cell, we actually treated the H cell and tried to remove it. And those folks, both groups, would follow every 6 months. These are our sites. I'm here in the middle of the country, slightly on the west side in Denver, but there are sites all along the East Coast, a few in the middle of the country, and then the West Coast as well. So how many people joined? 10,723 really generous individuals who were 35 years and older screened for anal H cell for the anchor study. Now, about 6,200 were not eligible, but 4,459 we found H cell, and we enrolled almost all of those individuals. 17 of the people who were screened for the anchor study had cancer found on diagnosis or on that initial screening study. So what that means is these individuals, if it weren't for the study, may have had their cancer go on for longer and spread further if they had not come into the anchor study to have this evaluation. So taking those 4,446 people that enrolled in the study, about half and half went to the treatment arm and the monitoring arm. In the treatment arm, there were 9 cancers that were found. And in the monitoring arm, there was more than twice that at 21 cancers found. So who was in the study? We had mostly male, 80%, with 16% female and 4% transgender, non-binary or other. And our participants were 42% Black, 32% white, 16% non-Black Hispanic, and a smaller percentage were unknown, and then 2% were Asian or Pacific Islander. So our results showed that this was safe. People tolerated this procedure very well. And they kept coming back to see us so that we could help monitor and check over time. So over thousands of study visits, only 8 participants had serious side effects caused by either treatment or monitoring, and those involved an infection or abscess, anal bleeding that was outside of the normal, an anal pain, as well as an anal skin ulceration or open sores. So the best part about our study is that it decreased cancer by 57%. It decreased anal cancer by 57% in the treatment arm compared to the monitoring arm. That means that anal H cell treatment prevents cancer more than half of the time. So we've stopped enrolling for the study once we had enough people who developed cancer. We stopped the study, and then now we're continuing to follow people. We showed that treatment was successful. And so now we're offering treatment to everyone in the monitoring arm. And this is an important point we want to make tonight. We think that everyone should get treated. And we're more than happy to take care of anyone that doesn't want treatment, but wants to continue monitoring. We want to make sure that we see everybody that's in our study and take care of them to the best of our ability. So anybody that has questions about this can ask their provider, as long as they try to come in to be seen and make sure that we're helping to take care of you. So we're going to continue visits until September 30th, 2024. So that gives us time to make sure that anybody with H cell is evaluated and treated. And sometimes it takes more than one time to treat the H cell. So that's why we're continuing to follow and collect information. We're going to find out more. So what else is going to happen as a result of this? Well, there are some expert guidelines that are underway, and they're trying to evaluate whether anal cancer screening and anal HSIL treatment should become standard of care. We all think that it should, and we're advocating to make sure that that is the case. But there's national guidelines now where they're taking a look at this and hopefully going to go along with our study results and help make this a standard of care so that everybody can have access to it. So a lot of people may have questions about whether their insurance will cover it. And the fact is, if it becomes part of guidelines, that pushes insurance companies to cover this treatment and evaluation for individuals. As it becomes standard of care, insurance companies will follow with coverage. And then professional groups are training more clinicians so that it's more accessible to have this high resolution anoscopy as well as the treatment for HSIL to prevent cancer. All right, so what's next? So we're doing additional studies to help us find the best ways to screen for anal HSIL and anal cancer, to treat, and then to find biomarkers that tell us who's at most risk for anal cancer. So biomarkers are any indicator of a health condition from a lab test, whether it's blood or tissue, something that can help us to figure out who is at risk for developing anal cancer from their HSIL. One of the things we'll be evaluating is HPV testing. So we'll find out the types of HPV that are associated with some of the changes to the cell. We're also looking forward to thinking about screening and treating other groups of people. So that involves other people such as men who have sex with men not living with HIV, people who have other immune suppressing conditions such as organ transplantation, and then women who have a history of vulvar or vaginal HSIL. So how can we stop HSIL from becoming cancer? Get a high resolution anoscopy and anal HSIL treatment. So you can continue this research, or you can take part in another clinical trial, or you can seek care outside of the anchor study for your anal HSIL, as long as you're getting into care. Additionally, you can care for yourself by making sure, if you're living with HIV, make sure you continue your HIV care, stay on your medication, continue to follow up with your provider, and quit smoking if you smoke. Smoking increases the risk of anal cancer significantly. We still need your help. So other studies are recruiting volunteers to continue answering questions about anal cancer prevention. And your participation, if you were an anchor study participant, was the reason for the study's success. I often tell my own patients, I'm so grateful that you spend the time with us every 6 months, and I'm grateful for you for coming to listen to me today and for participating in your own site if you're a participant. So Anchor is a historic study. This is the first time we showed that anal HSIL treatment lowers the risk of anal cancer. So this is going to change the way we practice. And these findings help folks with HIV and will help others at risk for anal cancer as well. The study results are being used to define new guidelines, new government and non-government guidelines to prevent anal cancer. There's still a lot to learn from the study. We have ongoing research that we're continuing to look at. And if we get any more breakthroughs, any more information, we'll make sure to communicate that information. So now we're on to the question and answer session.
Thank you so much, Hillary. We really appreciate your presentation today. I'm Julia Pugliese. I'm the project director with the Anchor National Team, and I'll be facilitating the questions that you all share with us. And as a reminder, if you'd like to ask a question, please feel free to type it into the Q&A box. You can check the option to ask your question anonymously, and I will do my best to make sure I do not read your name when I read this so that you can ask in a private manner. The first question we have from a participant concerns billing. This person would like to know about how they might be able to get reimbursed for a study cost. They say that the hospital has started billing me for procedures and sent the past due amount to a collection agency, so I paid the bill to protect my credit. How do I get reimbursed for this cost? Hillary, I'm happy to let you take this, or I'm happy to take this since this is frequently one of my responsibilities to help manage.
That's true. I will, I'll start, and Julia, you can add on. So this happens at my site sometimes. And what we tell folks is as soon as you get the bill, contact us immediately with a picture of the bill. And we can work on our end with the hospital to redirect the bill. At this point, now that you've paid the bill, and I'm so sorry you had to go through that. That is really a pain when things don't work the way that they're set up to. So thank you for paying the bill, and someone will be able to reimburse you as long as you have the documentation of payment. And I'm sure even if you don't have that documentation handy, someone will be able to help you get that. Just contact your site coordinator and they can help you with that. Anything else to add, Julia?
Exactly, that's it. We just want to extend our apology that that didn't get covered by the study in the first place. We are committed to our note in the consent form that states that we will cover the cost of procedures related to the study from the out-of-pocket perspective, meaning anything that insurance doesn't cover. That is related to the study. So again, please reach out to your coordinator. They will help arrange getting the documentation. If you have your receipt handy, that'll make it quicker. And they can submit that promptly for payment by the study so that you can be reimbursed. And that goes for anybody else listening. If you receive a bill, please reach out to your study coordinator promptly because it's very important to us that we honor that provision in the consent to cover out-of-pocket costs for our participants. All right. We have another question from the audience. What else can I do to prevent anal HSIL from progressing?
So the main thing to do is to see a provider who provides the HSIL evaluation and treatment. And if you're having trouble finding a list, I know that we do have a list. I think we were going to publish it on the study website. I don't know if that link is live yet, but that's a question that came up on Saturday at one of our other meetings, and there is a list for people around the country. So it doesn't have to be an anchor site if you're not already in the anchor study, or if you're in the anchor study and you move someplace else.
Yes, we have a link to that, and we'll share that link toward the end of the presentation. We're also putting it up on the Anchor study website. It is a registry that we're constantly updating, so please let us know if anything, any contact information is broken, but we do try to maintain a listing of all the HRA providers we're aware of. We have another question. One of our participants asks, I have never smoked. My partner of 40 years is a smoker. Does that increase my chance of catching anal cancer as well as lung cancer? Great question.
Yeah, that's a good question. If your partner smokes inside, that secondhand smoke, certainly can cause damage over time. So ways to get around that are to have the partner smoke outside. I know that's a hard ask, especially for somebody that's smoked a long time. But yes, secondhand smoke does affect folks as well.
Another participant would like to know, how can I help spread the word about anal cancer?
Thank you for asking. That's great. We have our CAB members. There are community groups within the International Anal Neoplasia Society as well for people who have experienced anal cancer. And so that's a community group where people can be involved. Being a part of if you're near a university or you're part of a community group, giving them the links for these talks and letting them know about the benefits of treating HSIL and screening with high resolution anoscopy will really help us spread the word. So any community outreach that can be done, including through talks yourself or linking to our talks that we've given. And if you're near an anchor site and you want someone to help give a talk to a group, you're welcome to reach out to the sites as well. I'm sure many people would be happy to speak to the community. And that's the reason we do this, is our connection and our passion for caring for folks in the community.
We have a related question. I'm interested in joining the Anchor CAB. Who do I contact?
Great. So on the Anchor website, on the anchorstudy.org website, there is a listing of a site near you that'll tell you who some of the CAB members are and also who the study coordinators are. If you're interested, please reach out to those individuals. Or if you don't find anybody that is in your area, you can reach out to the national study team as well. And that's all through that anchorstudy.org website.
Thank you. Next up, a viewer would like to know, where can I be screened for HSIL and cancer once Anchor ends, and how would that be paid for?
Yeah, that is a big question. So all of us are really committed to helping the people that are in the Anchor study find places to be able to get screening and treatment. The interval of treatment, so the every 6 months that we're doing now, that may not be the interval that people are evaluated moving forward. And then, like I said, we're working hard to make this a part of guidelines so that insurance companies will support people in their quest to make sure that they have their full health care, including their anal health care, taken care of.
Thank you. Another participant would like to know, am I cured if I haven't had any HSIL in a couple of years?
So that's a really great question. You know, there are a lot of different ways to look at this. The Anchor study is helping us to answer this question as well. So the great thing about this study is that we're following people over time. We're seeing what happens to people if you don't have any HSIL for years and years. What does that mean for you? So we don't have those answers yet, but we're continuing to gather that information in order to be able to give full guidelines for how often people need to follow up after they don't have HSIL for a while. There may be other tests that we do, including HPV testing, that help us to understand how often and what the risk is for someone needing to be seen. So for example, if you have no HSIL for a long time, and then you have a type of HPV that can cause HSIL that's still found on the anal pap smear swab, it may be that you're a higher risk than somebody that no longer has that high risk HPV. So the HPV is the virus, and it's very tiny, can live in the bottom of the, kind of in the basement layer or the bottom of the cells. And when we destroy the areas of abnormality, we don't know that we're actually removing all of the virus. So there may still be virus that can cause harm, and we don't know for sure that someone is cured of HPV or having HSIL in the future.
All right. Next up, if I or someone I know with HIV is diagnosed with cancer, are there any studies they can look at, since it seems many cancer studies exclude people living with HIV?
You know, that is true that many cancer studies have excluded people living with HIV in the past. Initially, the COVID studies, I was a part of those, they also excluded people living with HIV from getting vaccination, but we advocated, and they did include people living with HIV. I think it's always worthwhile if there are cancer studies that are meaningful or of interest to you as a participant or as a patient, that you reach out to the study team to see if that's possible for you to engage. And then we're part of the AMC, which is a malignancy consortium specifically for people living with HIV. And we study ways to prevent cancer in folks living with HIV. And HPV related cancers is just one component of that. So there are studies within the AMC that you may be able to participate in as well.
Thanks, Hillary. Yes, I'm aware of two ones they have open currently, one for early stage cancers, and then another one evaluating whether a lower dose of radiotherapy is possible to treat anal cancer. So please check the AMC website, and we'll make sure that we cross-link to that on the Anchor Study website. Next up, a participant would like to know, after the study ends, should I still try to get examined every 6 months?
Yeah, that's a great question. So we don't know for sure. We're gathering more information around that, and your provider will communicate to you individually to let you know how often they want you to follow up. I know that many people, if they haven't had HSIL for some time, their provider may space out the visits to once a year, and other providers may do something different. But I would work directly with your provider to determine what the best way to follow up would be.
Thank you. Another participant would like to know, how does anal cancer risk rate compare to other types of cancers risk rates, for example, colon cancer?
Yeah, that's a really good question. So it depends on the population. So if you're talking about the overall population, like everyone in the world or everyone, I know the statistics best for our country, for the United States. So looking at everyone in the country, the risk of anal cancer for just the average is 2 per 100,000. So think about that top number 2. And then we'll compare that to men who have sex with men living with HIV. That risk goes up to 131 per 100,000. So 65 times the rate, really a big jump for men who have sex with men living with HIV. That's the highest group, especially as folks are older. They are at a higher risk of anal cancer. So that high number compares to rates of prostate cancer. And what we know about prostate cancer, for example, is that many people can have prostate cancer that is very slow. And there isn't as much mortality or there isn't as much difficulty after treatment from prostate cancer compared to anal cancer. That's not always true, right? Some people have really advanced prostate cancer. Some people, so it's not comparing apples to apples. But my point is, in certain populations, that risk is really high, and it's definitely much higher than the rate of colon cancer.
Thank you, Hillary. Next up, an attendee would like to know what signs or symptoms should I be concerned about for anal HSIL progressing to cancer?
So the signs and symptoms of cancer are if someone has a new lump or bump, pain, bleeding, and it would be important to have that evaluated by a primary care provider, or if we're talking about somebody living with HIV, an HIV provider, to evaluate that and get you referred for that evaluation as quickly as possible. So it's confusing because a lot of people will say, I think I have a hemorrhoid, because they have a lump, they have pain in and around the anus. And it may be something other than a hemorrhoid. So it's really important to get it checked out and viewed by someone that knows what they're looking at. There's all kinds of things it can be. So just because somebody has anal pain and bleeding doesn't mean it's cancer. So I don't want anybody to get too scared from that, but it is important to get that evaluated.
Thank you. An attendee would like to know, is the study going to continue to pay $100 for study visits?
Yeah, during the study visit time up until September 30th, 2024, we are going to continue to pay the $100 visit for any high resolution anoscopy visit, including evaluation or treatment. And so we are committed to providing that payment for our participants.
And I should also mention that in the event there is a study visit where you do not receive HRA, as outlined in the consent form, we will still provide $25 for those types of visits. Next up, a viewer would like to know, why is the study ending at all?
Why is it ending at all? So we set out with a group of questions, and our main questions have been answered. We showed that treatment does reduce the risk of cancer. That was our main question. Another main question that we had was, is this safe? And we demonstrated very few serious adverse events, such as the ones I described of the bleeding, pain, and infection. So we really did show the answers that we set out to show, and now it's time to provide routine care. Not quite yet, but September 30th, 2024, moving forward, that'll be our chance to provide routine care. And our goal is to expand that care to everyone who needs it. And so we're working towards getting those guidelines passed so that everyone can have their insurance pay for these visits and continue the care.
Thanks, Hillary. A viewer would like to know, what are some of the best questions your patients ask you when coming in for a visit for HRA treatment?
That's great. There are some times where people come in, they've already Googled everything and they're super prepared. And then I have some people come in and they don't know anything about why they're there. So a lot of times we'll talk through, what is HPV? What is low grade squamous interrupted epithelial lesions? What are high grade? What is cancer? What is the risk? So a lot of the things we answered during this call, a lot of patients will then ask me, you know, how long are they going to have symptoms? After biopsy, hopefully only just a couple of days, or even they'll be fine the next day. I always recommend stool softeners, warm bath soaks, to really make sure people are comfortable after the procedure as quickly as they can be.
Thank you. Another viewer would like to know, is one form of treatment better or preferred over the other forms? Ointment seems much easier.
Yeah. So the ointment may seem easier, but you know, there's drawbacks to either. So the ointment's applied twice a day for 5 days and then 9 days off. And the ointment is a type of chemotherapy that acts directly on the skin tissue. And you can have some pain related to that. And that happens over the course of 16 weeks. It may not treat quite as well as the heating and removal of cells. So the electrodesiccation or hypercation, that is something that can be done, and then recovery occurs within a week. Whereas the cream, while it has its time and place, we may have to give that over the course of 16 weeks. And so that treatment can be a little bit more prolonged. Of course, it is easy. It can be done at home. Nobody has to take time off to come in for the treatment. So for some people, it may be preferred, and it's always recommended to have the conversation with your provider to determine whether you should have the heating treatment or hypercation or burning off the abnormal areas, or the cream, because there's a time and a place for both.
Another viewer would like to know, with men who have sex with men, is there a higher risk of having other cancers such as penile or prostate cancer if you have anal cancer or anal HSIL?
Yeah, so the penile cancer would be related to the anal cancer because both are often caused by HPV. The other cancer that is caused by HPV is oropharyngeal or laryngeal cancer, so like throat cancer. And so all of those are related to HPV. The way to evaluate for the penile cancer is just a physical exam and making sure to stay vigilant about that. Now, prostate cancer itself is not specifically related to anal cancer. It's not caused by the same type of virus, and it isn't related as far as causing cancer. So there shouldn't be any link to that.
Next up, a participant would like to know, why is the study continuing now that the question was answered?
So those questions are answered that I mentioned, the safety question and the reduction in the risk of anal cancer. But we still have further questions. Are there other characteristics, such as HPV type or other things that we can measure, that put people at risk for progression of HSIL to cancer? And so we're still continuing to study all of that information so that we can really refine our recommendations. So the people at highest risk are the ones that are getting screened. And so while we recommend right now that men who have sex with men, women, men living with HIV be screened, as well as some other populations, we don't have those specific guidelines yet. And so it's really going to help us to gather more information to support who should be screened.
Next up, a participant would like to know, does taking a sitz soaking bath increase or decrease the chance of anal cancer occurrence?
Okay, I'm going to answer that in a second. The other thing I wanted to say about, no, I just remembered when you were asking. Sorry about that, Julia. So the other thing I wanted to say is it's also really important to us that we make sure that everyone in the study who was in the active monitoring arm get that standard of care. So that means we showed that treatment reduces the risk of cancer. We want to make sure that everybody that stuck with us all through this time, all our participants that allowed us to monitor them over this time, that they get the treatment that we proved helps reduce their risk of cancer. So we want to make sure that we treat all of those folks. And that may not take one time, it may take a couple times. And so that's another reason that the study is continuing, to make sure those folks get the care they need. And then sitz baths. Do sitz baths increase the risk of anal cancer? They should not increase the risk of anal cancer. They can help take care of a lot of other things like hemorrhoids, fissures, or tears. They can help after the procedure, and we wouldn't recommend it if it increased that risk. So if someone wants to take a warm bath soak and help heal up anything from a procedure, we would recommend it.
Another attendee would like to know, what would you tell a patient who is nervous about getting treatment for anal HSIL? And is there anything that can be done to make the treatment more comfortable?
Yeah, that's great. That's a really good question. So when everybody walks through our door, there are a couple things we don't know. We don't know how nervous they are, and some people may not feel comfortable to even tell us how nervous they are. So being honest about it can help. Sometimes in some clinics, there's a medicine that people can take to help them relax. And that helps us as providers too. We want you to be relaxed, because then it's easier to do the exam, it's faster, it's kinder, it's gentler. So all of that is good. So be honest with us if you're nervous. And if you take one of those medications, you're going to need to have a driver. So you can always communicate with the staff prior to coming in to find out if that's an option for you to help you relax. And then another thing, what was the full question? Julia, remind me.
It was, what would you tell a patient who's nervous about being treated, and what can be done to help keep them more comfortable?
So that's how you keep comfortable. Another way is to make sure to take stool softeners after the procedure, so that you're not having hard stool or having to push or having to sit on the toilet for long periods of time. That actually can cause increased pain and bleeding. And so we want that process. I talk about this stuff all the time. I know a lot of my patients are embarrassed to talk about it. So one way I just talk about it openly up front, so that they don't have to feel uncomfortable talking to me about their poop, right? So that's one way I try. And I think that if people take some of these preventive measures, as well as the sitz baths that we talked about as well, all of that really helps the process be a lot more comfortable. Some people like to listen to music. I'm fine with that. Anything that makes somebody more comfortable, they can bring it up with me.
We're just about to the hour, so this will be the last question we take. This is, what other studies for anal HSIL can I take part in?
Julia, you mentioned you mentioned some studies. There is a topical cream study, AMC 088. Any others that you have at the top of your list there?
Sure. There's AMC 103, which is a immunotherapy that is an injection given in the arm that they're testing to see whether This creates an immune response to help clear anal HSIL from the body. Those are the two that I'm aware of right now through the AIDS Malignancy Consortium. And you can always check back on their website, as that group is constantly working on new studies. Some of the big questions that they're asking next after Anchor are going to be, what are some of the best ways we can screen for anal HSIL, and what are some of the best ways we can treat anal HSIL? And those studies are now in the planning process. But please know that we are seeing the end of Anchor as a touch point for many more studies to come.
That's right. So people's participation will continue on with the information and the learning that we have around anal cancer screening and anal cancer. So again, thank you. All right. So I just wanted to, again, give my deep gratitude, my very big thanks to all the Anchor study participants. Without our participants, none of this could be possible. And everything that we learn as a result of this and the care that is available to others as a result of the study is because of you. So thank you. I also want to give a big thanks to all of the Anchor investigators and all of the staff at the Anchor sites. This is a big study and there's lots of parts to it. And so having everybody come together and really help take care of our patients and our participants has been amazing. We also have to give a huge thanks to the CAB. Many of them have given us really critical input into the study to make sure that it meets the needs of the participants. We also want to thank the AIDS Malignancy Consortium. Anchor is part of the AIDS Malignancy Consortium, and so we have to give a big thanks to them for everything they've done. Additionally, MS has given us a ton of support and really kept us on track through the study. So huge thanks to them. And then thanks to the NCI and the Office of HIV and AIDS Malignancies. They provided the funding for this study, and without them, none of this would have been possible. So thank you for joining today's town hall. Here are some links to some of the sites that we discussed on this call, and including the list of HRA providers by site. And we really want to thank you for joining us, and thank you for participating if you are a participant. And that's it for now. More to come.
Thank you, Hillary. Stay well, everyone, and thank you again for joining us today.